All right, let's talk about cholesterol. It's something that affects millions of us. But here's the thing. Everything you thought you knew about the rules for managing it, well, those rules just got a massive overhaul. So let me ask you straight up, do you really think you know the latest when it comes to keeping your heart healthy? Because if you do, well, you might want to stick around. What we're about to cover could be a real eye-opener.
No, seriously. We're not talking about a little tweak here and there. The entire rulebook just got a complete rewrite. This is a big deal, so let's jump right in.
And this isn't just some new theory. This is coming straight from the top. We're talking about the brand new 2026 Dyslipidemia Guideline from the American College of Cardiology and the American Heart Association. This is the new gold standard that officially retires the old 2018 rules.
So what's new? We're going to break down the 5 biggest shifts. Cholesterol's got a whole new rulebook. We're looking at risk scoring that's way earlier and smarter. There are new numbers you absolutely need to know. Personalized goals are making a comeback, and maybe the most important part, what all this actually means for you.
All right, first up, cholesterol's new rulebook. You know, sometimes a simple name change can tell you everything. The old guidelines were about management of blood cholesterol. The new one, management of dyslipidemia. And that one word signals a huge, fundamental update in how we think about this. See, that name change is important because it reflects a much deeper scientific understanding of what actually causes heart disease. It's not just about LDL, the so-called bad cholesterol anymore. We now know it's about a whole family of particles that cause plaque buildup. So the focus is getting much, much broader.
The second big change? It's all about playing the long game. We are moving beyond just worrying about what might happen in the next 10 years. The new philosophy is all about earlier, smarter risk scoring to protect you for your entire life.
And this quote from the guideline really hits it home. It says we need to treat earlier to reduce lifelong risk. What that means is the real villain isn't one bad cholesterol test. It's the damage that adds up over a lifetime. You know, it's kind of like sun exposure. A little bit every day for years is what causes the real problems. Same idea here with cholesterol.
So how do we actually do that? Well, the old risk calculator is out. The new way uses something called the prevent equations. And check out the difference. The old way didn't even start until you were 40. The new way, it starts at age 30. And get this, it doesn't just calculate your risk for the next 10 years. It also calculates your 30-year risk. That's a huge shift in perspective. And they've even come up with this super simple way to remember the new process, CPR. First, you calculate the risk with that new tool. Then you personalize it, adding in other factors that are unique to you. And if things are still a bit fuzzy, you can reclassify that risk, maybe using a test called a CAC score. CPR. It's a really clear, logical framework. All right, number 3. This is where things get really interesting. If it's not just about LDL anymore, what are the new numbers to know? Well, there are 2 big ones that are about to become way more common.
First up is something called ApoB. Here's a great way to think about it. Your normal LDL test is like measuring the total cargo in a fleet of delivery trucks. But ApoB, it actually counts the number of trucks. And that's crucial because you could have a normal amount of cargo, but if it's packed into a ton of tiny, dangerous trucks, that's a problem. ApoB gives you the true particle count.
And then there's this one, LPA, or lipoprotein A. This is a real game changer because it's a hidden genetic risk. You could be the healthiest person on the planet, perfect diet, perfect exercise, but if you inherited a high LPA, your risk is still higher. It's almost completely determined by your genes, so it's a number you really need to know. And because it's genetic, meaning your lifestyle doesn't really change it, the new guideline has a very simple, very powerful recommendation. How many times should you get this checked? Just once. That's it. Every adult should have their LPA measured one time in their life. One test to uncover this major hidden risk factor.
Okay, big shift number 4. This one is kind of a back to the future moment. For a while, the strategy was just to lower your cholesterol by a certain percentage. But that one-size-fits-all approach is officially out. Personalized goals are back, and that's great news for everyone.
So what does that mean? It means instead of your doctor just saying, let's aim for a 50% reduction, they'll now say, based on your personal risk, your specific LDL goal is this number. We're talking about hitting an actual target again, not just a percentage, which lets treatment be way more precise.
So what do those goals look like in practice?
Okay, this chart from the new guidelines shows how it's all tailored to you. Now, it might look a little complicated at first, but the main idea is actually super simple. The higher your personal risk, the more aggressive your goal is going to be. Let's just break it down with a few examples. If you're in a pretty low-risk category, your goal for LDL might be less than 100. Makes sense. But say you have diabetes plus a few other risk factors. Boom, the goal gets tougher, less than 70. And for someone at very high risk, maybe they've already had a heart attack, the goal is now super aggressive. Get that LDL down below 55. See how it works? Totally tailored. Okay, so that's a lot, right? We've got a new rulebook, earlier screening, new numbers to know, and personalized goals. Which brings us to the fifth and honestly the most important part. What does this all mean for you? What should you do at your next doctor's visit? This is your action plan. These are the exact questions you can now take to your doctor. You can ask, hey, can we calculate my 10 and 30-year risk using that new Prevent calculator? You can say, should I get my LPA and my ApoB checked? And based on these new guidelines, what are my personal goals? And finally, is my current treatment aggressive enough to hit those goals? This empowers you to have a much deeper conversation. So when you step back and look at all this, it leads to a pretty big question. Are these new rules the beginning of the end for heart attacks? I mean, think about it. This is a massive shift away from just reacting to heart disease and toward getting way out in front of it, being truly proactive. By starting earlier, seeing the whole risk picture, and treating with precision, are we finally on the right track? It's a huge question, but for the first time, it really feels like we can start to ask it.